follow up on Zepbound updates and a weight loss Q&A that we are going to talk about GLP1 updates, your recently asked questions. I'm going to answer them. And if you join live, I'll answer the questions that you submit live as well. Anything medical weight loss, anything GLP1s, this is your time to ask. Let's get an update today with the questions you've been submitting. For those of you who are new here, I'm Dr. Jade. I'm a board-certified family medicine physician. I'm a medical weight loss specialist. I'm certified in obesity medicine. I own a private practice in Las Vegas called Inspire Primary Care. Here we serve a 5-star primary care and medical weight loss services. And you all have been asking us, especially on our YouTube page, so many questions about Zepbound. What are the latest updates? You guys have submitted some really great questions about that video. Our most popular video right now is our Zepbound update video that we did a few months ago. And you all in that video have had some great questions. So I want to address your questions. I put down the 5 most commonly asked questions to answer for you all today. As always, drop in the chat, where are you joining from? I love to know where you all are joining from. Of course, I am joining live in Las Vegas at Inspire Primary Care. So here we go. As you join, drop in the chat, where are you joining from? And then let me know if you have any medical weight loss GLP1 questions, and we will answer them. I will read your questions if you don't submit them live. I'll read them and come back on the next video and make content around them. Okay, so here we go. So again, those of you who are like, what are GLP1s? What is all of this? Let me explain that, because that was one of the questions. Some of you asked, there are so many different names to these medical weight loss medications. I'm really confused. I don't really know which one I'm on, what the difference between them is. So let's just clarify that part so we're all on the same page. So when we talk about weight loss, there are many ways to transition to a healthy weight. And one of the tools that can be used are medications that are FDA approved for weight loss. The most common in this season of life and the most effective are the GLP1 agonists, okay? Talk to your doctor on which option may be the best fit for your individual health. But in general, for most people, the GLP-1 agonist, if prescribed correctly by a certified physician who knows how to properly manage weight with medications, that is the most effective class of medications we have right now, the GLP-1 agonists. No, they are not for everyone. There are certain patients that may not benefit from them, but many of our members, after we do our assessment, have had so much success with them when utilized and prescribed correctly, okay? So the question is, tell me the different names. There's so many different names. Break it down. Okay. When we talk about GLP-1 agonists, these are the once-weekly injectables. There are the name brand of these medications, and then the non-name brand version, or the generic version, or sometimes the compounded version. So these are things to consider, okay? And so the name brand is first Ozempic, okay? Many of us have now heard of Ozempic. And then the competitor to that is Mounjaro. Many of us have heard of Mounjaro. When these medications first came out, they were FDA approved for type 2 diabetes. They helped with insulin resistance at the pancreas, thus decreasing the hemoglobin A1C and decreasing diabetes, okay? However, in the studies, they also found that many people lost weight and transitioned to a healthier weight, which not only helped their diabetes, but helped their other chronic disease burden. And so it was later FDA approved for obesity medicine or weight management, okay? When you FDA approve a medication, or when they FDA approve a medication for a new indication, for a new reason, they may oftentimes give it a new name brand name, although it is the same medication. So that is what we see that happened, okay? So Ozempic was renamed when it was FDA approved for weight management, Wegovy, same medication, and Mounjaro was named Zepbound, same medication, okay? And then the other thing to know is if you take the name brand away from those, Ozempic or Wegovy, that is semaglutide. They are both semaglutide. And then if you take the name brand away from Mounjaro and Zepbound, that is tirzepatide, okay? So you may hear some people say they're on any of those things. Ozempic, Wegovy, or semaglutide, all the same thing. Mounjaro, Zepbound, or tirzepatide, all the same thing. They are competitors, okay? Ozempic and Wegovy, semaglutide inhibits or is a GLP-1 agonist, blocks the hormone GLP-1, while Mounjaro, Zepbound, tirzepatide blocks GLP-1 and another hormone called GIP, all right? GLP1 agonist and GIP agonist. And because it blocks two hormones that deal with difficulty maintaining a healthy weight instead of one, in the studies, Mounjaro, aka Zepbound or tirzepatide, led to about 5% more weight loss in studies. So when people ask, how much weight will I lose in how much time? Again, it depends on if you are seeing a physician that specializes in weight management and if they are prescribing it correctly and safely to help progress your weight loss safely, okay? If that is the case, of course, if you're in Las Vegas, you know that's Inspire Primary Care. If that is the case, the studies and what we see at our office, which aligns with the studies with Ozempic, Wegovy, semaglutide, is typically 15 to 20% weight loss in 6 to 12 months. And then with Mounjaro, Zepbound, tirzepatide is typically 15 to 25% weight loss over 6 to 12 months. And so about 5% more weight loss on average with Mounjaro, Zepbound, tirzepatide. All right, so I hope that clarifies that question. As you all are joining, I see you all joining. Drop in the chat, where are you joining from? We're doing a Zepbound, GLP1, medical weight loss Q&A and update. So drop in the chat, where are you joining from? And if you have any questions along those lines, drop them. I'll answer them live. We're going over the top questions that I was submitted lately. So the first thing was breaking down the different names of these medications. Name brand versus generic versus compounded. Now we have broken that down. We're all on the same page, okay? The next commonly asked question that I was submitted recently along these lines was, do I, Dr. Jade, do I offer telehealth in other states? So at the time of this recording, I am licensed in the state of Nevada only. I provide primary care and medical weight loss services, both in person and virtually, if you're in the state of Nevada, if you're a Nevada resident. However, we are considering, I've been getting this question so much lately that our business is considering adding additional licenses in other states to offer telehealth weight management in additional states. So if that's something you're interested in, drop that below. If we get enough people requesting that, then we'll consider if that's something we want to add on. We've been so busy with our Nevada residents that it hadn't made sense to do that yet. But if the demand is there, we would consider adding that. So drop in the chat, where are you all joining from? And if you would like for us to offer telehealth weight management in your state, drop that. If we get enough requests, then we'll consider adding that in the future. But at the time of this recording, I do in-office and medical weight management for the state of Nevada only. All right. And if you're in Nevada, you join our practice by joining Inspire Primary Care at inspireprimarycare.com. No I in front of Inspire. You hit the enroll button shaped like the Las Vegas sign. It takes you through the steps to join our practice, okay? And then this is a really good question that was asked is, and this is asked a lot, do you have to be on these medications forever? I have addressed this in some of our other lives and some of our other videos, but it's such a common question that I'm gonna answer it again, okay? So do you have to be on medical weight loss medications like GLP-1s forever? Okay, so the way to break this down is, when you're joining a medical weight loss program or thinking about utilizing medications for weight loss, the program you join should have a primary care onboarding where they're doing labs, making sure that the weight concerns are not related to any other health issues, that you don't have metabolic syndrome or type 2 diabetes or hypothyroidism, that there just aren't other metabolically related or other things that are causing difficulties maintaining a healthy weight. So that should be screened first of all, okay? And then when you join a program, they should be having a strategy and structure for the weight loss phase, and they should be having a strategy and structure for the weight maintenance phase. And that is a very important thing that we have here at Inspire Primary Care, which makes us much different than a quote unquote weight loss clinic, okay? So with that in mind, when you come back to the question, do I have to be on these medications forever? There are many different reasons that people struggle with maintaining a healthy weight. And so when we look at addressing a yes or no to that question, it really comes down to the individual of what is your individual health reason for needing or requiring medicines for weight loss to help you transition to or maintain a healthy weight. If that is more of a situational reason, for example, if someone always had a healthy weight and then they got pregnant and then now they're postpartum and they're having a hard time transitioning back to a healthy weight and losing the baby weight, then utilizing GLP-1s or medicines for weight loss may help them transition back to their healthy weight range, may kind of realign and resettle their, original metabolism and hormonal balance, and they may then be able to transition down and off of weight loss medications, GLP-1 agonists, for example, and maintain their healthy weight with a healthy lifestyle. Side note, another important part of a medical weight loss program should be a personalized wellness plan component, which is another big key part of what we do here at Inspire Primary Care, is having the personalized wellness plan using our trademark method, the Inspired Health Method, where we are addressing the lifestyle components along the journey while utilizing medications for weight loss. So when we take medications away for weight loss, if that is the right fit for you as an individual, we still have been utilizing a wellness plan that we are going to continue long-term or lifetime to help maintain that healthy weight we have used or transitioned towards. So if that makes sense, if it was a situational reason, another common situational reason is if someone had a temporary disability, like they broke their leg, they gained a lot of weight because they weren't able to be mobile, they weren't able to work out, they weren't eating as healthy, and then that no longer is an issue. They're now healed from that injury, they're more active, they're doing a personalized wellness plan. The GLP-1 agonists have helped them transition to a healthier lifestyle and a healthier weight, and now they're able to maintain medication free, okay? Then you have people, so that's one bucket of people. The more common thing is people who have, a genetic propensity. So people who typically see me have tried, quote unquote, everything. They tried eating healthy. They've tried working out. They're still gaining weight. They may be in a different hormonal season of life, like they've gone through menopause and hormones and estrogen is decreased and declined, and weight is more difficult to stay in a healthy range. For those people where there's a hormonal component, where there is a genetic component or genetic predisposition, then those population of people, if you take the tool away that helps them to transition to a healthier weight, they may reset to their normal baseline. Their hunger centers in the brain's hunger and satiety centers will reset to normal. Their body's hormonal set points will go back to its normal set points. And so all of that is why we will typically see the weight come back as the medications are tapered off, if hormonal or genetic predisposition are your reasons for struggling with maintaining a healthy weight. So all of this, long story short, should be tailored to the individual. It's not just a yes or no answer. It's what does it look like for you as an individual? Why are you as an individual struggling to maintain a healthy weight or finding that difficult in this season of life? Why is this tool actually working for you? Is it because it's making you less hungry and your portion sizes are smaller? Is it because it's working at the different organ systems hormonally and that's why you're transitioning to a healthier weight? All of that will make a difference on if this is something that should be shorter term for you or long term or lifetime for you as an individual to help you maintain and transition to a healthier lifestyle and a healthier weight. So I hope that answer and painting that picture and using some of those examples again helps to address how long or if you need to be on this forever. What these medications should not be looked at as is some sort of fad diet, short-term fix, like, hey, I have a wedding that I want to look good for next month. I want to get on some shots for a month. That's what these are not for. Okay, this is for longer-term obesity management, for people who are struggling with weight, who have been struggling with weight, who have made an effort to transition to a healthier lifestyle with the things that are within their control with wellness, and it has not been successful, and they are looking at these other tools. And without them, they're, maybe at risk of needing surgery, like bariatric surgery, or they have other chronic diseases that are happening and developing because they have been increasing in their weight, like obstructive sleep apnea, type 2 diabetes, high cholesterol, hypertension, for example. Okay, so these are not fad diet medications. This is not some quick fix. We are looking at this as a whole person. All right. And for some people, they're able to transition to and maintain a healthier weight with lifestyle alone. And for many people, lifestyle alone is not enough to help them transition to and maintain a healthy weight long-term or lifetime. And for some people, many people, utilizing tools like GLP-1 agonists in addition to a personalized wellness plan is a very successful tool to help people transition to and maintain a healthy weight. And that's what we specialize here at Inspire Primary Care. As you join, drop in the chat, where are you joining from? Drop any questions you have. I will answer your questions live. And I see one in the chat, and I'm going to answer that one. So I see Rosie BMP. Where are you from, Rosie BMP? You said there are shortages on these drugs. Do you compound formulations? If so, are they effective? So this is a really, really good question. Thank you for that question, Rosie BMP. Let me know where are you joining from. So yes, we are still seeing national shortages throughout the whole country, national shortages on the name brand GLP-1s like Zepbound, Mounjaro, Ozempic, and Wegovy. The companies like Eli Lilly, who manufacture and make these medications, they have had severe shortages. I guess the supply and demand they're very behind in putting out enough medications to supply the demand in the country for not only type 2 diabetes, but also for weight management, because most adults in the United States are overweight or obese, okay? And so the demand is there and their stock is low, and so there have been national shortages. So here at Inspire Primary Care, I do know some pharmacies in town that are able to keep a stock better or the best in Las Vegas. That's the benefit of my members being a part of our practice. I know which pharmacies in town have the best stock in the city for these. However, even those pharmacies have had more shortages lately for the name brand medications, which has forced many physicians and many practices to at least look at the options of offering compounded or generic versions of these medications and partnering with pharmacies that are approved to compound these medications. And yes, they have semaglutide and tirzepatide. So our office is no different in that regard. I found the best offices in our area, the best pharmacies in our area that offer compounded medications that are approved and certified in that have sterile labs. And yes, we do partner with them because of the shortages. When there weren't shortages, we only offered name brand. Now that there are so many shortages, we offer both name brands and we partner with compounding pharmacies that are the best in our area. Okay. So yes, we offer both options because of the shortages. And so yes, that's a great question. And then the other question, I really like this, is if you do partner with compounding formulations, are they effective? So this is really, really important, especially when you're going to weight loss clinics. So what I'm seeing a lot of is many clinics will order the medications and they're able to kind of mix it, water it down, which stretches out the amounts that they're able to inject with people and drive the price down. And they're able to offer like cheap shots. So you'll go some places and you'll say, oh, they only charge this much and they charge this much. And so one thing I recommend is not shopping around for the cheapest price, because if the price is so much less compared to the market price, there is a reason. And that should raise a red flag in your mind, okay? And asking them, why is this so much less expensive compared to everywhere else? Because the medication costs what it costs. It is pricey. So yes, we offer both name brand and compounded. And yes, they are the pharmacy we partner with, and the medications we use are straight tirzepatide, straight semaglutide, nothing else added in, no vitamins or fillers or anything added in. And so yes, they are just as effective. We are seeing the same percentages, the 15 to 25% weight loss over 6 to 12 months with both the name brand and generic options. So that was an excellent question. And Rosie BMP says she is from Fayetteville, Arkansas. So Arkansas is in the house. Thank you for that question. That was a really, really good question. So you all let me know if you have any additional questions on that, because the shortages is another hot topic. And let's see, another question I had was, what's the best nutrition for medical weight loss programs? I actually just did a whole video on this. Our last live was on that. So check that out. Go to our YouTube page at Dr. Jade MD. Go to that and you'll see the video that says nutrition, best nutrition for medical weight loss. We just did a whole video on that. So thank you for that question, the person who submitted that. And those were our most recently asked questions about GLP-1s, Zepbound, medical weight loss. Those are the most commonly asked questions. I'm scrolling the chat. I don't see any additional questions in the live chat, but I will come back and look at your questions on the playback. So drop any questions that come up. I'm happy to answer them. I want you guys to really be educated about medical weight loss, about how to safely choose a medical weight loss program if that is the right fit for you to help transition to a healthier lifestyle and a healthier weight, for this to not be looked at as a fad diet. The field of obesity medicine is very exciting right now because we do have tools that can help people effectively transition to a healthier lifestyle and a healthier weight, help people reduce and prevent chronic disease, and help people avoid surgeries, like bariatric surgeries for many people. So that is why this field is so exciting. This is why I'm so passionate about it, because I've seen how many people we are preventing and reversing chronic diseases for. And so that's our mission here at Inspire Primary Care, in addition to serving up 5-star primary care and medical weight loss services. So let me know if you have any additional questions. If you're in the Las Vegas area, I would love to care for you. We are now enrolling new medical weight loss and primary care members at inspireprimarycare.com. No I in front of Inspire. And thank you all for being here today. Excellent questions. And I'll be on the lookout for the next questions, and I'll come back and do the answers to those on the next live. Have a great day. Bye.